Hey guys, thanks for tuning in to my series of videos on pain management. This is Dr. Thacker from beautiful Las Vegas, Nevada, and I'm coming to you from our Summerlin location. Don't forget to hit like or subscribe if you like what you're hearing, and if you'd like to come and see us, don't hesitate to call 702-545-0660 or see the information down below at the bottom of your screen. So we talked about pain management. Our philosophy of pain management begins with taking a careful history and listening to the patient, which is the key to diagnosis. And then I showed you some advanced technology that we use to diagnose pain, including nerve conduction studies and point of care ultrasound right there at the bedside when you come in. We can use an ultrasound device to either make a diagnosis, assist in that, or to guide an injection for precision. Now, I want to talk about the most exciting aspect probably of pain management, which is regenerative medicine. Regenerative medicine is stimulating the body's own natural healing properties. And as some of you that know me from the area know, I teach some courses in this several times a year here in Las Vegas and occasionally in nearby states here on the West Coast. And regenerative medicine is, of course, an area of tremendous interest by the public as well as medical professionals. And I want to start it by talking about what's at the forefront of regenerative medicine, and that is platelet-rich plasma, also known as PRP. So PRP therapy is a 100% natural way to harness your body's own regenerative powers. In PRP, we take a small sample of blood from you, about 10 milliliters, so about what goes in a little test tube when you get your bloods drawn to check your cholesterol, about the same amount, one test tube full. And we take that and we process it in a centrifuge in a special way that separates out all the parts of the blood and allows us to isolate the platelets. So you've got your red cells, you've got your white cells, and you've got platelets, which are almost like cells. They're literally like plates that don't have a nucleus or a core, so they're not quite cells, but they're very special anyway because they release your growth factors. When you're injured or if you're trying to stop something from bleeding, you're trying to clot off something, the platelets release the chemical signals that allow all of the growth and healing to take place in those situations. So the platelets release the growth factors. So when we spin the blood in a centrifuge that spins it around at several times the force of gravity, we are able to concentrate those growth factors and give them to you, your own blood, your own growth factors, give them back to you by injecting those into the area of concern, such as a painful knee joint, for example, or your elbow is very painful. Some of these areas are so well established that even you can obtain insurance coverage for the procedure in select cases for the exact diagnosis. That's why it's important to go to someone that is very familiar with regenerative medicine that can determine what to do, where, and why. And in some cases, insurance coverages may exist for some of these injections. But the reason it's so incredibly popular in the media and with other physicians is because we know it's had some very powerful and lasting results for some of our patients. I find that the key for determining how best to use PRP and other regenerative therapies is asking the most specific question possible. So sometimes I'm asked, does PRP work? Or does PRP work for joint pain? The answer is always, it may, it depends. A better question is, after a thorough evaluation by myself, a better question is, would PRP work for medial compartment degenerative joint disease in this specific patient's knee? That is a very specific question that can only be asked after a careful, thorough examination and answered by regenerative medicine. And the answer for many patients is yes for many conditions. So you need to really select carefully someone that's familiar with this and that can offer this with a high degree of precision. So by making a diagnosis and developing a unique treatment plan using these regenerative therapies, I'm able to best produce lasting results for you to relieve your pain. And there are even some various nuances of PRP. Some people while we're separating out all the red blood cells by spinning the blood, we can sometimes, for some patients, add back some red blood cells, and that's sometimes done for joint pain because red cells carry oxygen, right? And occasionally now people are asking about the fibrinogen, which is, they call that the fibrinogen therapy and platelet-rich fibrinogen therapy. And what we're doing there is we're including select other cells. So by carefully tuning exactly what we're giving you, just the platelets, but a little bit of red blood cells, platelets and a little bit of white blood cells. We're fine-tuning this for your condition in regenerative medicine. So that's very important. And there are some other techniques in regenerative therapies that are also very exciting. As some of you know about these stem cells, and stem cells exist. And one way of getting stem cells, probably the best way, is to get stem cells from the patient. And that is from fat. So when we do what's called fat transfer, we take fat where you don't want it, like your love handles, and using liposuction, we then harvest the fat, and we can place that fat where you need some structure, like for a thinning, aging face. But there's also this very exciting possibility that when we're transferring the fat, we know there are these adipose-derived stem cells. And many of us believe that in some cases, these stem cells have these powerful properties of fostering beneficial growth of the body for areas where you're experiencing pain or other conditions. So this is all investigational. And whenever we're talking about adipose-derived stem cells and this type of thing, there are no medical claims made because stem cell therapy is cutting edge, and whether it works or not is a subject of tremendous interest in regenerative medicine. But this is another option for people that want to try this because many people do believe, and there is some research and speculation about the benefit of these stem cells. So that's another aspect of it. But right now, the cornerstone of the regenerative medicine would be, I would say, the PRP, modifying PRP like I've described by adding back certain cells to make it platelet-rich fibrinogen or PRP with some red cells. And then also this fat transfer has a lot of cosmetic uses. And when we consider the fact that it has stem cells in that fat that we get from your love handles and liposuction, when we consider the fact that it has stem cells there, it becomes very exciting, the possibility that this might be able to be used for healing properties. So if you're interested in regenerative medicine, I invite you guys to hit like and subscribe and come and see us here in beautiful Las Vegas, 9420 West Sahara, Suite 105, and give us a call at 702-545-0660 if you'd like to see us. I hope this has been informative. This is Dr. Thacker signing out. Thanks so much and be well.